Hi, this is Tim from ChiroUp, and I want to share with you 3 simple steps that you can use right away to increase the number of medical referrals to your practice. First of all, medical referrals are based upon relationships, and relationships grow through shared experiences and meaningful communication. And really, there's no better opportunity for meaningful communication than sending a primary care physician a note about their patient when they present it to your office, especially an initial visit summary and a release report. On the initial visit summary, you don't want to send just your SOAP note because that's 8 pages of conglomeration of a bunch of macros that you don't read and they don't read. But the providers will read a brief summary of that. So what we do is we send an initial visit summary that says, Dr. Smith, your patient Mary Jones presented to our office today with a chief complaint of back pain. My diagnosis was a lumbar disc lesion. My treatment will include spinal manipulation and exercise. I'm going to treat the patient 3 times a week for 2 or 3 weeks, and I expect her to be 50% better by that point in time. That quick summary is something that gets read and makes an impression. But what makes an even bigger impression is step number 2, sending that provider a release report once the patient is done with care. Let's face it, we only hear about each other's failures. When's the last time you heard about a success of a muscle relaxant or an inversion table? It really doesn't happen, because if the first mode of care worked, the patient wouldn't be seeking an alternate mode of care in your office. And the same thing's true about MDs. They only hear about our failures. But what if they could hear about our successes? What if every MD in the country could hear about the success that took place in every chiropractic office? That would change patterns. So the one way that you can make that happen and increase the number of MD referrals you see is to send a report when the patient is done with care that basically says, Dr. Smith, your patient Mary Jones, who presented to my clinic 3 weeks ago with a chief complaint of lower back pain, has undergone 6 treatments. She reports resolution of her chief complaint, and at this point in time, I'm releasing the patient back to an as-needed basis. That's a report that does get read, it does make an impact, and it does change referral patterns. It's a huge tool. And tool number 3 is to ask that patient to become an active participant in this marketing process about your outcomes. Ask the patient once they're done with care, would you share your experience with your primary care provider? They are oftentimes willing to do that, and that makes a huge impact because there's few more meaningful conversations than a patient telling the MD about how they improved underneath your care. And that takes about 2 seconds of my time, 20 seconds of my staff time to leverage the power of my outcomes to use as a marketing tool to increase my MD referrals. It's powerful. In our office, we see about 300 MD referrals a year, and those are the primary tools. I hope you've enjoyed this short video. If you have any questions, you can check into ChiroUp. If you're a subscriber, we'd love to show you how to use those tools more potently. If you're not a subscriber, we'd love to have you join our team and make a difference in the future of our healthcare profession. Thanks for watching.